Hi, I'm Chris Urquhart, publisher of Natural Awakenings magazine, and I'm here today with Dr. Melissa Dean. Dr. Dean specializes in integrative and anti-aging medicine. She has her master's in metabolic medicine and a master's in nutritional medicine. Thank you so much for joining us today, Dr. Dean.
Hey, thank you. Thank you for having me.
So COVID-19 is on everyone's mind right now, and we keep hearing the phrase cytokine storm, and we kind of know it's related to the immune system. But maybe you can help put it into perspective for us on how that relates to also taking care of ourselves and boosting our immune system.
Sure. There's a lot of information out there as far as the COVID-19 is concerned, and I know everybody's scared and, not always clear on the information you get and things along those lines. So my understanding, again, I don't know that there's any tremendous news line that comes into physicians specifically. We have organizations we belong to, including the AMA and Florida Medical Association, and I belong to a couple other organizations more in the functional medicine that we gather the information, then process it through. And so, my understanding of the COVID-19 is that is so devastating on people because of the damage of the process of the virus itself on the lungs. So, that's why they say that I believe, if my statistics are correct, and people, can hold me to that, once put on a ventilator, that a small percentage would actually get off the ventilator. That's why they celebrate, you see on the news, they celebrate people who actually came off the ventilators and went home. So the inflammatory process that damages the lungs. And once that process with the cytokines, which can be pro-inflammatory and anti-inflammatory, but once that cascade and a process with the cytokines takes place, then unfortunately the damage to the lungs is not oxygen dependent. In other words, you can be put on a ventilator and, essentially be forced oxygen through the ventilator system. That doesn't help because there's so much inflammation and damage being taking place within the cells of the lungs themselves. So it becomes important to modulate that system and try and damper the pro-inflammatory response in the body, that cascade. Hence we've tried, they have a few experimental drugs and such to try and calm down the virus itself. Ventilators have been used throughout this whole process. But then we see the people who have the higher risk people who have, many of them have problems with the immune system already, given the comorbidities, the medications they're on. There's a lot of inflammation we see one of the highest populations being targeted by this virus with the poor outcomes are the obese. So we go into that whole inflammatory response of obesity. We look at obesity as an inflammatory disease. So you're already inflamed. And I believe, again, that what happens is you end up with this virus that causes a cytokine storm with more inflammation, unless you have some means to dampen that inflammatory response. Then it just becomes, throwing things throwing things on the wall and see what sticks to try and treat. Since we still have no specific treatment protocol that seems to work the vast majority of the time.
So it would make sense then that working on our immune system from an anti-inflammatory perspective would be helpful, even though people who get very sick, the cytokine storm, it's not that our immune system, if it's super healthy, is going to turn against us. That's not what we're looking at. We're looking at trying to stay in an anti-inflammatory state, right? And
correct.
What are some things we can do to put ourselves in the best position to stay healthy?
Well, I always say, one of the biggest swear words that I can think of is for most Americans is balance. So our immune systems are constantly in struggle of balance, too much or not enough inflammation. We've been designed to have a sort of a domino effect, and that domino effect can be good or bad depending on which pathway we go down. So to have a balance in our lives with the nutritional aspect and natural supplements that can help to modulate that whole immune system. Vitamin C being one of those that we've found many times can be truly so beneficial for people depending on what it is we're trying to treat. It's certainly, shall we say, enhances the immune system, but it doesn't lead it down a pathway where it's pro-inflammatory. So it doesn't over-activate the immune system like an autoimmune diseases and such. what it does is it gets more of a healthy balance and strengthens the immune system to fight things more naturally. You know, we've got limited studies and data available other than what we've learned from Europe and China with this COVID-19 specifically. But one of the studies that came out of China, you know, guaranteed is very small, but again, you know, we haven't had a lot of time to get mass studies with, you know, blind placebo trials and things along those lines. So the one study that came out from China was that they treated, I think it was 38 people with IV vitamin C. And out of that, they all recovered without any lung damage and such, and did really well. So, you know, if you extrapolate those findings out into the population, the funny thing, you know, and ultimately that helped the whole cytokine system. It dampened down the inflammatory response of the virus so that there wasn't the lung damage and the, you know, end organ damage that can happen with the COVID-19. But what was really funny with the China study was specifically that the doses that they used were not even tremendously high doses. I think the study was based upon 1,500 milligrams, but it was given like 4 times a day, and it was given IV versus oral, you know, powders and different methods that we actually will use vitamin C. So again, you know, the one patient that I've treated, that I've had the honor to actually interact with and treat was, we did IV vitamin C at what would be considered to be high dose, but is actually a low dose relative to the high, so at 12.5 grams. And we did that with some ozone. And so, you know, we have a man who had some comorbidities and was at high risk, who had become infected, who's actually done very well and never required hospitalization. And as you know, as soon will probably be back to work as long as once he gets his strength back from being down for 20 days with this virus. So, but
that's great that he's stayed at home and made able to recover that.
Oh yeah, for sure. So, you know, so there's supplementation again, you know, so the pros and cons with supplementation and things like IV vitamin C, you know, I say the difference, you know, between getting IV vitamin C in various places, for me, the big, for our practice here is that, you know, we use things without preservatives, and, you know, there's no corn syrups or anything else put into them as preservatives. But also, you know, if that isn't available to somebody to help boost the immune system, because I think prevention is always much better than worrying about treating for a disease. And if that's not possible, then the next best is to get things that are liposomal, you know, because you have better absorption. They're taken orally, but you have better absorption of liposomal products. You know, because limiting factor when you start using just oral doses of vitamin C is many times the GI tract gives out long before you can get to any significant dose.
Vitamin C flush, right?
Right. You know, so you can take, 5 grams a day or something along those lines, but by the time that happens, then yeah, you've got the colon has gone into protest, right? And you end up in the bathroom and things along those lines. Where with liposoma, many times you can get a little bit of a higher dose to trying to maintain that immune response, to try and help better and fight these diseases that come along.
So you have a kit, right, that you have in your office that maybe has some liposomal vitamin C. Yeah, there it is.
Yeah, there you go.
Does it have the vitamin D as well that you were talking about? And
yes, so vitamin D. The only practice I know is my own. I've done this for years and years. Seems like yesterday I started, but it's been, I think, like 14 years. It's much to our surprise, living in paradise with the sunshine that we have. I tell you, probably 60 to 70% of the patients who come into me are actually vitamin D deficient. I think we rely upon the sunshine, and there's a couple factors that involve there. But ultimately, vitamin D is so important for the immune system. I mean, research has linked low levels of vitamin D to breast cancer, colon cancer, prostate cancer, arthritis, depression. So although it's a vitamin, it's also a hormone for the brain. So there's a real important need there. But I say in my experience, we're always, I say, garage door communities. Those of us who live here, we have a garage door, we get in our car, up goes the garage door, we go to work, we come home, the garage door goes up, we're back in there, and we don't exactly, most of us, lay out in the sunshine anymore. or if we have, or we did, the dermatologists have shamed us, because we, you have that balance again of worrying about melanoma, things along those lines. So, and then the older we get, the melanocytes in our skin that actually absorb the vitamin D and process it in our body, the older we get, the less that functions very well in our skin. So, I hear people say, well, okay, I'll spend a little more time in the sun to get the D. Well, that doesn't always work either. So many times it's just more convenient to get where you have a little bit of a controlled as far as the dose of it, and I monitor levels for people to achieve the levels that we need, again, to try and optimize the immune system. So for me, this kit has been a wonderful thing for people, just simply because it's concise, it's all consolidated into what we've suggested. But vitamin C, zinc, D3, and glutathione are other things that I've added, specifically for people who want to get these supplements separately, that those, help the immune system, to balance out the immune system, to strengthen it to the best we can. But again, it certainly does not flow over to that pro-inflammatory response.
So when we were talking about the immune system and the pro-inflammatory cytokine storm, is there anything we can position ourselves so that we're in a better position for that not to happen? Are there supplements for that?
Again, a lot of the supplements that we use are similar. So the C, I think, is really good. A lot of it comes down to gut health. I mean, this probably sounds sort of wonky to a lot of people, but when you realize 80% of your immune system is around your gut. So if you're eating preservatives and foods that are irritating to you, unhealthy, processed, and things along those lines, so you're naturally in an inflammatory state. People don't always realize that, but when you're already in an inflammatory state, then to remove those foods and try and decrease the inflammation is a wonderful thing. And if you don't know that and you're just trying to use supplementation, you can, the omega-3s at a healthy balance can also reduce inflammation. A lot of people have based weight loss on omega-3 and dampening down the immune response. We know turmeric can be very beneficial for a lot of people also. Those are the biggies there. I think glutathione is wonderful to pull toxins off the body, so it's not an added burden. It's not specifically an anti-inflammatory as much as it is to decrease some of the toxic burden. In this kit, you've got the immune PRP spray, which has got the bovine colostrum in it. And again, for those that don't know, colostrum is, from the mother's milk. That's part of the immune system that comes right initially from breast milk. We have a farm, and we learned that firsthand with we were breeding Belgians, and one of the little foals who mother didn't nurse properly. We literally had to give the colostrum, manually to the foal to make sure it would live, because without a healthy immune system based upon the colostrum, then the animal would have died. And the humans are similar. If our immune system isn't strong and we don't have the natural bovine, the polypeptides that come from the bovine, and the vitamin C and the vitamin D, then our immune system just is not going to be as healthy as it could.
Got it. So how are things in your office? Are you having to make a lot of changes while people are under the stay-at-home orders, or are you still seeing patients in the office?
We see a few intermittently in person. There are people who are truly sick with other things. They've got, sinus infections. I saw some the other day for an ear infection, things that you specifically, you want to look and make sure what's going on. Some of the other things like urinary tract or whatever, many times we can deal with over the phone. But we've turned the vast majority to telemedicine, doing phone conferences, Zoom, when we can. A lot of people just aren't even equipped with computers, the elderly and stuff. But we've gone to great lengths to try and keep certainly those at high risk, to not be out in public. People who want to purchase products here, we ask that they call ahead. They can pay for it. One of the girls will go out and take it out to them out in the parking lot, so that they don't even have to come into the office. But if you're sick and you come in, we've got masks, and try and follow some of the protocols, suggested by the CDC. Because we've got some other people who have things that can't be put off, cancer patients and things along those lines, who are, doing some treatments through us. So we just try and use those precautions for them, put them in separate rooms, so nobody's close to one another, and have the masks and such. So we've learned to accommodate because, it's so important for some people to still seek the treatment of a physician versus trying to, treat themselves at home or get sicker without.
Yeah. It's great how quickly you and everyone has adapted to this situation in order to, just use common sense and all be as safe as we can be to avoid this crazy virus we've got.
There's another swear word, common sense.
Right. Exactly. Well, thank you so much for your time today and sharing your knowledge with us. We certainly appreciate it.
Oh, thank you.
So those of you who'd like to contact Dr. Dean, she's in Vero Beach, 1345 36th Street, or you can give her a call, 772-567-1500. Maybe ask about that immune kit. They'll bring it out to the curb for you. And you can learn more about, there it is. You can learn more about her practice, which is integrative and has lots of fabulous services. So I encourage you to go to deanwellnessinstitute.com. So thanks again. We appreciate it. And everyone, be well, stay connected.
Take care. Stay healthy.